My name is Bill Botel, the Director of the HIV/AIDS project at the Lowy Institute. I'd just like to introduce Alex with the bare bones of his CV. Alex is a physician by training. He's been Director of the Alcohol and Drugs Service at St Vincent's Hospital since 1982. His interests include the prevention of HIV among injecting drug users, brief interventions for problem drinkers, prevention of alcohol problems, treatment of drug users, and most importantly, in terms of what he'll talk about today, drug policy reform. He's President of the Australian Drug Law Reform Foundation and was President of the International Harm Reduction Association between 1996 and 2004. He helped establish the first needle syringe program in Australia in 1986 and the first medically supervised injecting centre in 1999 in Australia. Alex works in developing countries on HIV control, particularly amongst injecting drug users. He's published over 200 scientific papers. He helped establish the National Drug and Alcohol Research Centre in 1987, the New South Wales Users AIDS Association in 1989, and the Australasian Society of HIV Medicine in 1990. And for 20 years he has really led the policy response and fight in relation to drug use, its connection with HIV. The great strength of Alex, though, is he has derived his policy analysis and recommendations from his first-hand experience of his clinical patient load, from the experiences of his colleagues at St Vincent's and in and around Darlinghurst and Australia and the world, the doctors and the carers and the social workers who come into contact with the users of drugs, and of course with the injecting and other illicit drug users themselves. So his policy analysis and recommendations are derived from actual practical experience on the ground. So it gives what he has to say to us today a great weight and authority, not just derived from the intellectual analysis, but from practical, pragmatic and daily experience. So it's my very great pleasure to introduce to you today Dr. Alex Wodak.
Thank you very much, Bill, and thank you for the generous words, and thank you also to the organisers for asking me to speak on this subject. I'm going to talk about the global war on drugs and ask the question of whether the end game has started. The aims of global drug prohibition are to minimise the availability and use of specified prohibited drugs for recreational purposes, and this all came about because of the passage of 3 international drug treaties which have been widely supported throughout the international system, and the development of a whole system of arrangements within the United Nations to ensure that these international drug treaties are implemented. The second aim is also to ensure the adequate availability of drugs that are prohibited but nevertheless are required for medicinal and scientific purposes. And I'm going to show you data that neither of these aims are in any way met. There are many indicators of drug prohibition working or not working, and I'm going to concentrate on these ones that you see before you. Are we able to make illicit drugs scarce? Are we able to increase their price and lower their purity? Are we able to reduce consumption? And how confident are we that the benefits of drug prohibition, which almost every member of the United Nations has signed and ratified these treaties, are we confident that the benefits of this approach outweigh the adverse effects? Well, as I'll show you in a moment, drugs are still readily available, and prices, rather than rising, have been falling dramatically, and instead of purity falling, purities of these drugs has been increasing. I'll show you data about that as well. Global production has been increasing for a long time. I'll show you data about that. The benefits, in fact, are very hard to identify, but the adverse effects are multiple, severe, serious and obvious. And relevant to a foreign policy institute, some of those adverse effects are serious effects on national security, and I'll show you that as well. What you see before you now is global illicit opium production from 1990 to 2007, and you see a rectangle over the year 1998 in the middle of that graph, showing production, world production of opium at a little over 4,000 metric tons. And by 2007, that had increased by 103%, more than doubled, to 9,000 metric tons. Now, the significance of those dates is that in 1998, the United Nations Office on Drugs and Crime, UNODC, appeared before the international community at the United Nations General Assembly Special Session on Drugs in New York in June 1998, which I attended. And UNODC used the slogan, "A drug-free world, we can do it." So, how well did they manage with opium? Well, global opium production more than doubled in 10 years when it was supposed to have disappeared to zero. And here's global cocaine production in the same period, and global cocaine production increased 20% from 1998 to 2007 in that decade. And here's global cannabis production, increasing by 36% in the first 6 years after 1998. I haven't been able to find figures for the decade. I'm now going to show you some data on the availability of illicit drugs in Australia. And you'll see here heroin availability from 2000 to 2007. And those drug users who thought that heroin was easy or very easy to obtain are coloured blue on those bars. And as you can see, from 2001 onwards, between 60% and 85% of Australian drug users thought heroin was easy or very easy to obtain. Last year, 2008, not on this graph, 85% thought heroin was easy or very easy to obtain. Here we see cocaine availability, and we see that from over a similar period, we see that 40 to 60% of Australian drug users thought that cocaine was either easy or very easy to obtain. Here's methamphetamine powder. And you can see that over the last 5 or 6 years, 80% of Australian drug users thought that methamphetamine was easy or very easy to obtain. Slide before you now shows heroin and cocaine prices per gram from 1981 to 2002. This is a study that was commissioned by the European Commission from Peter Reuter, an Australian, and Franz Trautmann. This shows global illicit drug markets over this time, and you can see that heroin and cocaine have declined in price from around about $600 per gram in 1981 to less than about $100 or less in 2002. So they've declined by about 80% over a 21-year period, when, according to prohibition, the price should be going up. These are figures from the United States Drug Enforcement Administration, and they show, in the top left, that the price of a unit of heroin was $3.90 in 1980. 19 years later, that had fallen to 80 cents. Purity in the same period had gone from just 3.6% in 1980 to 38.2% in 1999. And these are the figures from the European Union, 2001 to 2006, for 7 drugs, and they show a reduction in price by at least 10% to up to 50%, with ecstasy falling 50% and brown heroin falling 10% in that period, and the other drugs between 10 to 50%. Here are heroin prices for the US in blue and Europe in magenta. Between 1980 and 2005, and you can see the same substantial decline in price for heroin in US and Europe over that period. And here we see cocaine, again the United States in blue, Europe in pink, and again similar reductions, substantial reductions in price over a 15-year period. This shows you the rate of incarceration for drug-related offences in the United States. And in 1981, the United States had a mere 50,000 people incarcerated for drug-related offences. By 2002, 500,000 Americans were serving sentences for drug-related offences, a tenfold increase in that period of 21 years. What had happened to heroin and cocaine prices? Well, you can see cocaine in the black bars, heroin in the grey bars, and you can see the same substantial fall in heroin and cocaine prices. The United States now has more of its citizens serving sentences for drug-related offences than the whole of Europe does for all crimes, and Europe has 100 million more people. And here's US expenditure in the dotted bar for international overseas supply control. And you can see that expenditure has increased from around about $500 billion in 1981 to around about $3.5 billion in 2004. And during that period, heroin and cocaine prices, as shown in all the other slides, has been falling dramatically. So I'd put it to you that global drug prohibition really has failed, and I'll argue that not only has it failed, but it is a futile endeavour. The second major aim, I remind you, was that we were supposed to get, as a benefit of this system, that we were supposed to have adequate medicinal and scientific supplies of prohibited substances if required for these purposes. In 1999, 15% of the world's population accounted for 87% of the lawful global consumption of morphine. Australia, happily, is in that 15%, and most of the developed countries in the world are in that 15%. But if you live in Guinea-Bissau or Papua New Guinea or one of the developing countries, and you have the misfortune to develop severe pain from cancer, your chances of getting adequate supplies of morphine are very poor. The USA accounted in 1999 for 4.7% of the world's population, but accounted for an astonishing 49% of the lawful consumption of international morphine, and accounted for 99% of the consumption of sustained-release oxycodone. It's estimated there are 20 million new cases of cancer around the world each year, and only half of those new cases, 10 million people a year, are going to receive adequate pain relief when their cancer reaches an advanced stage. What have the benefits of global prohibition been? It's very hard to identify any, but in the last 40 years we've had a few indications of success, perhaps. There was a brief period in the United States in the 1970s when there was a heroin shortage, and this occurred at the time when the French Connection was identified and broken up. New Zealand has had a heroin shortage since 1981, after the Mr. Asia Syndicate was broken up, and that heroin shortage has persisted for all those years since 1981 up to the present. It helps to have a relatively small population of about 4 million people, a lackluster economy, and to be surrounded by 170 million square kilometres of Pacific Ocean. For the people who strongly defend the war on drugs, Sweden is seen as a model because of alleged low levels of drug consumption. We have to remember that Sweden lies on the periphery of Europe, not right at its centre. Sweden is one of the more rural countries in Europe. Sweden also spends a great deal of money on its health and welfare systems and provides good care for its citizens. And also, very importantly, Sweden is one of the less unequal countries in the developed world, and there's a strong correlation between economic inequality and high rates of illicit drug use. Some would argue that Australia's heroin shortage since the year 2000 is the result of drug law enforcement. I find this a difficult argument to sustain because Australia imports almost all of its heroin from Burma, and heroin production in Burma has declined by somewhere between 80 to 90% from the mid-1990s up until now. Other countries also supplied by Burma, such as Western Canada and some of the Southeast Asian countries, Malaysia, Thailand, have also had a reduction in heroin use. But nevertheless, this is an argument that is still sustained. There are other possible explanations for the heroin shortage in Australia, including a tenfold increase in the consumption of heroin in China over the 1990s, and a lot of the heroin reaching Australia transits through China on its journey to Australia. It's also another possible explanation in that the production of heroin shifted to production of amphetamines and trafficking in amphetamines, and it may be that it was the switch from heroin to amphetamines that accounted for the heroin shortage in Australia. Apologies for this long quotation. It comes from the United Nations Office on Drugs and Crime website, and the United Nations Office on Drugs and Crime is the major international defender of drug prohibition. And this is what that organisation has to say about the adverse effects of the very system it tries to defend. Global drug control efforts have had a dramatic unintended consequence, a criminal black market of staggering proportions. Organised crime is a threat to security. Criminal organisations have the power to destabilise society and governments. The illicit drug business is worth billions of dollars a year, part of which is used to corrupt governments, officials, and to poison economies. Drug cartels are spreading violence in Central America, Mexico, and the Caribbean. West Africa is under attack from narco-trafficking. Collusion between insurgents and criminal groups threatens the stability of West Asia, the Andes, and parts of Africa, fueling the trade in smuggled weapons, the plunder of natural resources, and piracy. In addition to this, we have the existence of at least half a dozen narco-states. And these countries aren't all narco-states at any one time. They swap around a little bit. By narco-states, I really mean countries where it is very difficult to say who is the drug trafficker and who is the member of the government. They seem to be very blurred. And by narco-states, I'm including countries like Afghanistan, Pakistan, Burma, Colombia, Peru, Bolivia, and Mexico. I think we should also focus our mind on the problem of narco-terrorism, where known terrorist organisations traffic in drugs to fund their operations, to gain recruits, and also to gain expertise. In Colombia, we have the Revolutionary Armed Forces of Colombia and the United Self-Defense Group of Colombia on the left and the right. We have similar movements in Peru. And of course, we have the Taliban operating in Afghanistan and Pakistan, deriving a great deal of their funding from the trafficking in opium and heroin. In November 2008, the United States Joint Forces Command released their annual survey, known as the Joint Operating Environment, and they said, quote, "In terms of worst-case scenarios for the Joint Force, and indeed the world, two large and important states bear consideration for a rapid and sudden collapse: Pakistan and Mexico. The Mexican government, its politicians, police, and judicial infrastructure are all under sustained assault and pressure by criminal gangs and drug cartels." In the public commentary about these two paragraphs, didn't take long for the penny to drop, that what connects Pakistan and Mexico are the fact that both are narco-states. To return to the situation in Pakistan and Afghanistan, let's remind ourselves Pakistan is a nuclear-armed, unstable country that is always under the threat of coming under control of the Islamists. And the neighbouring country, Afghanistan, we have more than 40 countries with more than 60,000 troops forming the International Security Assistance Force. And they are in military operations against the Taliban, who fund the military operations, at least in part, through the sale of opium and heroin. It's now 20% opium, 80% heroin. Afghanistan is producing 93% of the world's opium, and this constitutes about 50% of the national economy. And 70% of the heroin and opium produced in Afghanistan comes from the southern provinces of Helmand and Kandahar, provinces which, of course, are under the control of the Taliban. I want to turn now to examination of what experts think. You've heard or divined what I think about this problem, let's see what the experts say, and we'll start off with two Australian experts. HNP Wollaston, a bit before my time, was the Commonwealth Comptroller General of Customs, and in his annual report to the Commonwealth Parliament in 1908, reporting on taxes, he said the following quotation: "I want to explain that until 1906, edible opium in Australia was available, was taxed and regulated. In 1906 it was prohibited." And this is why the Comptroller General of Customs made this comment in 1908 to the Australian Parliament, when he said, "It is very doubtful if such prohibition has lessened to an extent the amount which is brought into Australia. Owing to total prohibition, the price of opium has risen enormously. The Commonwealth gladly gave up about £60,000 revenue with a view to a suppression of the evil, but the result has not been what has been hoped for. What now appears to be the effect of total prohibition is that while we have lost the duty, the opium is still imported pretty freely." In 1989, 20 years ago, the Parliamentary Joint Committee of the National Crime Authority said, "All the evidence shows, however, not only that our law enforcement agencies have not succeeded in preventing the supply of illicit drugs to Australian markets, but that it is unrealistic to expect them to do so." George Shultz said, after leaving office as the former US Secretary of State, said in 1989, and importantly he made this comment at Stanford University when he didn't realize that he was being taped, and he said, "It seems to me we're not really going to get anywhere until we can take the criminality out of the drug business and the incentives for criminality out of it. Frankly, the only way I can think of to accomplish this is to make it possible for addicts to buy drugs at some regulated place at a price that approximates their cost. We need at least to consider and examine forms of controlled legalization of drugs." Richard Holbrooke, US envoy to Afghanistan and Pakistan, said earlier this year, "The United States alone is spending over $800 million a year on counter-narcotics. We've got nothing out of it. Nothing. It's the most wasteful and ineffective program I've seen in 40 years. Milton Friedman, Nobel Prize winner in economics, said, "Drugs are a tragedy for addicts, but criminalizing their use converts that tragedy into a disaster for society, for users and non-users alike. Our experience with the prohibition of drugs is a replay of our experience with the prohibition of alcoholic beverages." And in 2002, in a meeting with President Vicente Fox of Mexico, President George W. Bush said, "As long as there is a demand for drugs in this country, some crook is gonna figure out how to get them here." Let's turn to the United Kingdom. David Cameron is the leader of the Conservative Party of the United Kingdom and may well become the Prime Minister of Britain next year. And he said in 2005, "Politicians attempt to appeal to the lowest common denominator by posturing with tough policies and calling for crackdown after crackdown. Drug policy has been failing for decades." David Cameron was a member of the Select Committee on Home Affairs, which reported in 2002 to the House of Commons, and part of its report said, "If there is any single lesson from the experience of the last 30 years, it is that policies based wholly or mainly on enforcement are destined to fail. It remains an unhappy fact that the best efforts of police and customs have had little, if any, impact on the availability of illegal drugs, and this is reflected in the prices on the streets, which are as low as they have ever been." The chair of that committee was Chris Mullen, and he said in 2002, "Attempts to combat illegal drugs by means of law enforcement have proved so manifestly unsuccessful that it is difficult to argue for the status quo." In 2003, the Blair Cabinet commissioned the Strategy Unit, which is a research entity available to the UK Cabinet, to do a report on drug policy. And they, in their report, which was a confidential report, not expected to be released to the UK public, but leaked in 2005 by the Guardian newspaper, they said a sustained seizure rate of over 60% is required to put a successful trafficker out of business. Anecdotal evidence suggests that seizure rates as high as 80% may be needed in some cases. Sustained successful interventions on this scale have never been achieved. Elsewhere in their report, the strategy unit said, over the past 10 to 15 years, despite interventions at every point in the supply chain, cocaine and heroin consumption have been rising, prices falling, and drugs have continued to reach users. Government interventions against the drug business are a cost of doing business rather than a substantive threat to the industry's viability. On May the 7th this year, in a major report on HIV/AIDS, the UN Secretary-General Ban Ki-moon said, many countries impose criminal sanctions for same-sex sex, commercial sex, and drug injection. Such laws constitute major barriers to reaching key populations with HIV services. Those behaviours should be decriminalised, and people addicted to drugs should receive health services for the treatment of their addiction. So note that comment by Ban Ki-moon, these behaviours should be decriminalised. Now, I would argue that we are now seeing the beginning of the end. I remind you that on January the 20th this year, President Obama took office, and he became the third president in a row to have admitted to using cannabis. President Clinton did so with his famous comment that he had used cannabis but had not inhaled. President George W. Bush was taped without his knowledge by one of his advisors, and he admitted on tape that he never wanted the US public to know that he had consumed cannabis himself, and so he would never admit this. But when President Obama was asked the have you ever inhaled question, he said, of course, that was the whole point. So, he's also on record having said in the Senate, the war on drugs is an utter failure. He's also said that I believe in shifting the paradigm, shifting the model so that we focus more on a public health approach. And during his presidential campaign, he made commitments to overcoming the federal ban on funding needle syringe programs and also to stop federal interventions in states which have permitted the medical use of cannabis, and there are now 13 such states in the United States. In February, we had a report released from the Latin American Drug Policy Commission, and among the many commissioners on that project were three former presidents from Brazil, Colombia, and Mexico. Cardoso from Brazil, Gaviria from Colombia, and Zedillo from Mexico. And they concluded that the drug war is a failure, and they recommended breaking the taboo on an open debate, including about cannabis decriminalisation. In March, we had a meeting of the United Nations Commission on Narcotic Drugs in Vienna. And this, after a laborious process, a very important meeting. This was a 10-year review of global drug policy. And the culmination of this was the preparation of a political declaration, which was agreed with some difficulty by all the countries represented. And despite the overwhelming support for including harm reduction in that text, the United States managed, and a few other countries managed, to exclude this term from the text, the final political declaration, and the exclusion of this term caused a major split. 26 countries, including Australia, demanded support for harm reduction by the inclusion of a footnote in the political declaration when it is published. In May this year, we had the Governor of California, Arnold Schwarzenegger, saying, well, I think it's not time for legalization, but I think it's time for debate. He was referring to cannabis, and he was referring to this specifically because a growing argument in California for taxing and regulating cannabis as one of the ways of overcoming California's $26 billion debt. California is really effectively bankrupt. Former President Vicente Fox of Mexico said in May, I'm not yet convinced that that's the solution, but why not discuss it, referring to legalization. And the current Vice President of Colombia, and it's very significant that this is now a current senior official, Francisco Santos Calderon, said, the only way you can really solve the problem is if you legalize totally. Anything different than that will not work. Also in May, we had the new US drug czar, Gil Kurlikovsky, in the Wall Street Journal, recommending the abandonment of the term the war on drugs. In Germany, in the same month, 63% of the members of the Bundestag voted to allow heroin prescription treatment. And this month, the German Parliament has also decided that heroin prescription treatment will not be will be regarded as a normal part of the medical treatment system. And I've already mentioned Secretary General Ban Ki-moon's statement that drug injection should be decriminalised. We're also seeing this very significant change in the opinion polls in the United States, especially on attitudes to cannabis. So the Zogby poll, which was a national poll in April this year, to the question, should marijuana be legal, taxed and regulated, the vote was 52% nationally and 58% in California. A national poll by ABC News and the Washington Post in the same month, April, responding to the question, do you favour legalising small amounts of marijuana for personal use? The response was yes, 46%, and this was double the level that was seen 12 years earlier. And in the field poll in California in April 2009, 56% to a similar vote, to a similar question. And in another vote in California, in a month earlier, in March, 54% thought cannabis should be legal for adults, and 50% thought that it should be taxed at the same rate as alcohol. This is a compilation of all the polls on cannabis in the United States since 1969, and the green level, the green at the bottom of your slide, is for legalizing marijuana, and the red at the top of the slide is for opposing marijuana. And what you can see is that there was only 10% support in 1969, and there's been movement up and down in the meantime, but by the time we get to 2009, over 40 years' time, we see that support is now, when we put all the polls together, is now clearly over 40%. And this is really very important. It's not over 50% yet when we look at all the polls, but it's moving that way.